Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Good afternoon. Once again, it's Breast Cancer Awareness Month, and if you've had or are planning a breast reconstruction surgery, we have some of the latest information to share and look good on your lunch hour today. Joining us now, Dr. Joel Maier of the Advanced Cosmetic Surgery and Laser Center. He is a specialist in breast augmentation and reconstructive surgery. What is the most common way to rebuild a breast, say, after a mastectomy?
One common way is with implant reconstruction. It has its advantages and disadvantages, but it's a quick reconstructive option where you insert the implant in the skin flaps, which is usually immediately following the mastectomy. It's usually done in one stage, although they can be done in a delayed fashion, but one stage is best for time considerations and healing. But we basically have silicone and saline implants for this purpose. Silicone is a popular option.
About that, in the saline, is there one safer than the other when it comes to the implants? Because a lot of women are always worried about that. You know, you certainly don't want complications later.
Yeah, that's a great question. Generally speaking, the implants do have more complications and long-term issues as opposed to autologous or using your own tissue, which we'll get to. But silicone implants specifically, up to 6 years have a very low rupture rate. But after 6 years, they start ticking up. 10, 15% can rupture, and at that stage is when we do surveillance. MRI, ultrasound, whatever your local radiologist uses, every couple of years you have to have these checked out for rupture. And if they're ruptured, then we have to replace them. So this is something that needs to be informed consent when we're going over the options. Saline is different. When they leak, it's obvious and it's a fairly easy exchange, but they don't have the same soft feel. Generally in breast reconstruction where there's no tissue, we are going for the silicone because it does have more of a soft feel, but know that.
Well, and we know, I just talked to a breast surgeon this week who said that really the plastics people in this kind of give them back their joy or, you know, a piece of what's sort of been missing. So given that you can use your own tissue or an implant, what should you consider when making that choice?
Well, it depends. If you are someone who is willing to have an implant, then by all means, it's simpler. Just have to have the long-term kind of surveillance that you have to use. But there are autologous, using your own tissue, which is a very good way of reconstructing the breast, and it's long-term with very little worry. A popular procedure is to use the lower abdominal tissue or the roll below the belly button and transport that up and to make a breast with it. And it makes usually there's enough tissue to make a proportionate breast. Once it's in there and it's healed, it's your own tissue. It feels like tissue, it responds like tissue, and you don't have the foreign body long-term problems. I would add that there's two ways of doing this lower abdominal reconstruction. One is called a tram, and they take the lower abdominal skin and fat, and based on the rectus muscle, or the muscle of the abdomen, that's the blood supply, they kind of transport the tissue up on that muscle as the blood supply. Now that's one way of doing it. You're sacrificing a muscle to get that done. Really, the state-of-the-art way to do it is through microsurgery, where they take the same skin and fat and they dissect out down to the blood vessels, and instead of taking the muscle, they just transport it up to the breast, where they, under a microscope, sew it in. This is the state-of-the-art way to do it. I think the best way, because you're not sacrificing any muscles of the abdomen. And there are teams that do these routinely with very low complications. So you just have to discuss that with your reconstructive team, which option you're going to choose. But that's the very common autologous way, other than implants.
Right, excellent. So great conversation to have with someone like you. You can find out more from the Advanced Cosmetic Surgery and Laser Center. As always, the best option for you is the one that you and your doctor decide together. Thank you so much for sharing your information. We've certainly made a lot of improvements, and that's encouraging to so many struggling with this. Dr. Maier, thank you for being here today.
Thank you very much, Liz.